So having welcomed Keith into our team as a clinical pharmacist has been really good for the practice. He performs a role quite similar to what someone like a nurse practitioner would do, in that he can see patients with a wide variety of mainly minor illnesses. And we've found that he's been extremely useful and welcome part of the team, and very adept at managing minor illness, and only sometimes needs to come and seek advice regarding perhaps more chronic or complicated conditions. This is fantastic for the practice. He actually adds lots of additional knowledge from his pharmacological knowledge, which we will often go to him for advice about certain medications, so it's great to have him on board and present in the building for those kind of questions.
Having a clinical pharmacist like Keith at Northgate has been really beneficial from a nurse point of view as well, for prescription signing, advice on minor illnesses, and sometimes more chronic things as well. He's always been very approachable, and personally he supports me in the warfarin clinic and anti-coag management control as well.
Having a pharmacist here makes a big difference for me personally, because apart from helping out the doctors with the drop-in and emergency clinics and going out on the home visits, a lot of these patients are housebound. I'm never going to get them in. So I'm able to do review sheets that so that the pharmacist can, it might be dementia, mental health, diabetic, asthma, whatever, and it's like a guide sheet, and it's so that he can help me out with that.
To help them along. Also, it's great having Keith as a practice-based pharmacist, because we can liaise with him as another clinician, and he's got a good idea of what pharmaceutical products are out there.
And having a prescribing pharmacist on board is brilliant, because we have a lot of urgent prescriptions that need attention, and Keith is able to do that for us, and also be able to give the administrative staff a number of information about medication that we can't get from the doctors as they're seeing patients on a regular basis. And that is basically it. Yeah, it's brilliant having him on board.
Keith has been extremely helpful in the surgery, seeing patients in drop-in and doing telephone calls, both of which reduce our acute workload. He also has helped with the paperwork by looking at pathology results, doing DocMan. He does medication reviews. All in all, very helpful.
Hi, my name's Ty. I'm one of the community pharmacists. We work next door to Northgate Health Centre. They've just got a new clinical pharmacist over there, and we've been finding it fantastic, really, because a lot of the queries the clinical pharmacist are able to understand coming from a community pharmacy aspect of it, in terms of supply issues, continuation of brands as well, and also sorting out other queries, clinical queries as well. It's been a great help, because they were able to get back to us quite quickly, and the answers they've given us is sort of consistent of what we sort of believe in terms of coming back from a pharmaceutical sort of background. Okay.
Hi, I'm Lisa Chapman. I'm the practice manager here at Northgate, and I seem to hide behind piles of paperwork and don't do anything else, obviously. Clinical pharmacists, we employed Keith basically because his CV dropped on our doorstep, and we thought it would be a good idea. At first we really didn't know what to do or what his role would actually be, and it has evolved in the last 6 to 7 months. It's been great. He sees patients in surgery in the drop-in clinic, which is almost like an urgent care everyday service for our patients. He does home visits. He takes telephone consultations as well. With an admin role, he does some of our DocMan. He looks at path links for patients, and we have a lot of involvement with the CCG Meds Management team, and Keith and I work very well together on that, in line with all of their policies. We use the Eclipse software to analyse what we're doing and how we're doing it, and Keith takes an active role in managing any of the changes, the contact of the patient, so it's working really well in practice at the moment. It's a new role, we understood that, and it's evolving all the time.